I have questions to ask tonight, this morning, and we have a severe case that's happening to lots of people, a lot of people that are around in this continent and outside the continent. And well, I have you to talk to. So, Dr. Ruth, what do you have to say about PTSD, post traumatic stress disorder? What do you have to say about it? Because a lot of people are really struggling with it, and we need to do some. It's the longest it goes on is the longest it's gonna get to people. Actually, what do we say about it? What do we say about it?
Thank you. Thank you very much. Uh, I am specialized in a lot of issues that are happening to lots of women who are going through this. It's mostly for women, and I need to tell you that I have a severe case from one girl that I've been experiencing from. She came to me, and it has been quite a long time for her to be going through that, and but it really helped her when I counseled her. But all they need is a counseling, and that's the basic thing they need: a counseling and a good relationship. That is a basic one that is going to come from a parent or a relative, someone who is going to be there for them, just like a long term relationship. Huh? Haji?
As you told me before, actually, that you're taking care of a case about a lady who is in Tanzania, actually, and she absolutely goes through a lot of trauma. We call it trauma too because it's a situation that she's gone through, because she can manage a lot of things in her life, and there's a lot that's not going well to her. So she's managing a lot in her life, and she's not working. She's a very significant figure. Would you like to tell us more about her? Tell us more about her, and give us a real picture of her disease, and you can explain more. And of course, there's a lot that we need to hear from her so that we can learn to not prolong it to other people, not prolong it to the rest of the people in this continent, especially in Africa.
Thank you. Thank you for the question. Thank you for the question. And I want to tell you that she was in a relationship. She was in a relationship with with a very strong one. Not a strong relationship, but she was a wishful person. She wished for a relationship for a long time. She never survived from it because the time that she thought she's going to get into a relationship, that's when she was attacked and abused sexually. I wouldn't like to tell you this because the story itself tells itself that she was struggling to get into a relationship from the very beginning, even to have a sexual life. But her name, I would like to preserve her name because the story itself is very scary. Um, it's traumatic because she was suffering trauma from the very beginning. So you can see, I would like to explain what trauma looks like. It's trauma. It has nothing to do with her ability because she was a wishful person. She wished for a relationship for a long time, and she never had a relationship from the very beginning, even from her family. So she had to end up in an attack, and it really, really driven her into becoming a very, very disorganized person. You can see from this picture, actually can see people are trying to get into something and then they end up being abused from the same thing. It's like people are wondering, is she going to not stay there and not have a sexual life? No, she was trying to get into that from the very beginning, but it failed. That's why we are here talking about it. It's a post traumatic stress disorder. She said stress disorder. It is a traumatic stress disorder. She has been lots of angers, and lots of angles about trying to engage into her life and fix her life.
Did she like anybody in her life? Did she like anybody or had a really? Because we're trying to base into a sexual life. Actually, because people like her look like they don't have a basic relationship. Does Did she have a normal basic relationship in her life? Did she have a very normal basic relationship in her life? Did she like anybody or anything that has to do with a relationship away from the cycle of life, like education, environment, sex, and everything? Did she like everybody? Did she like the life that she lived?
Thank you again for the question. And actually, she 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 stayed a long life single. She stayed in a long life single, and she never had a relationship. But she really was trying the best, and she tried. She was insecure about her skin because her skin was very mistled. She had a mistle, so she thought that men wouldn't like her. So she never was liked by anybody. Basically, then when she graduated from college, then she met an Indian, and he was a Gujarati. Actually, he never ended up very well in her life because that man was very abusive because he was straightforward to her point. He was really driving her into a driven life. I never wanted to tell the story itself, but I'm going to tell you anyways, because in most cases you find a girl who's trying to enter something, and somebody comes with the same vibe but in a very rushful way. So she was very condemned by her family, and she never thought she could handle it that way. That man proposed and came to her, but she never liked it. She never wanted to be married. She wanted a normal life and to survive in her life. But I'll tell you the truth. Most people that are coming from this kind of circumstances, they end up in a very long trauma. A trauma. I call it trauma, but people are calling it there's a disease they call it in this nation, in Tanzania. But you can know there's a thesis that we need to find out from the rest of us. If you come to engage to this person in a very normal way, you can find them very interesting, and they have a lot to tell you. They have a lot to do with you. Just get them into that life cycle, and they need to have that life, because most of these people, these women, are abused from their past relationships. They were abused, and this man came to her, but he never even considered to ask her even one question, even a little bit. He was just very interested in to marry her and just abuse her. He thought that she was very insecure about herself. But he never thought that he was abusing her insecurity. She was very insecure of her body, and she was very insecure of her skin. So this man was very interested into very abusing her. So he came to her and very vibed. He was a vibing person, and he just ruined the vibe. I don't want to get very emotional about it, because you know that this is a situation that happens to lots of people in India. But this was an African. So the families were not very well into that, and they never driven it very well. It's a very unusual circumstance. Very unusual.
Thank you a lot for your time, and I think we had a very good chat today. We are not really looking like it's going to stop here, because this is the beginning of this conversation, and we had a lot to talk to. Uh, so I see you coming back to us, so we can have a lot to talk about it and reveal this PTSD kind of situation. I pray that we have a phobia kind of relationship with these people and relate to them and engage to them in a very major way. And of course, I call it phobia, but on my side. So for winding up, I just try to tell you that thank you very much for joining us, and Dr. Ruth. It has been a pleasure. A pleasure to be with you. A pleasure.
Thank you. Thank you very much. Thank you very much. And I hope to come to you next time, I'm going to come back to you.
Okay, this was a topic about the show of phobia, trauma, PTSD, post traumatic stress disorder. So, thank you very much, and join us later in the show. Thank you very much, and have a good evening and have a good day. Nice week.